Good morning to all who are joining us now live on Zoom. Welcome to the hashtag ThisWorks or ThisWorks webinar series of the Philippine Economic Zone Authority in cooperation with WHO, DOH, and also the DTI and Department of Labor and Employment. My name is Dr. Albert Domingo from the WHO Philippines Country Office, Regional Operations Pillar Lead, and it is my distinct honor to be the moderator for this webinar series, which will run from today, September 1, to September 4. Let me just unshare the screen so that we will now see all of our other speakers and panelists for this morning. We will be introducing all the speakers and the panelists as we go along. The format of this webinar is fair and simple. 30 minutes of discussion on the topic for today, which is waking up on a workday. And then after that, we have 30 minutes for a moderated question and answer. Right now, I'm just checking the screen and looking how many participants we have. We have a full Zoom room of 500 and 723 on YouTube. For those who are not able to open YouTube, I will be sharing the link to YouTube inside the chat box shortly after Dr. Ivy Nolasco, our speaker today, starts delivering the lecture. And you are most free to share with your friends and colleagues. How does the moderated Q&A work? Those of you inside the Zoom interface will see a Q&A button at the bottom of the screen. You can click it. It brings up an interface where you can type in the question that you are thinking of. If you see another question which you are also interested in, you can always upvote by clicking the thumbs up sign, and the moderator, that's me, will see it and will be able to ask it from the speakers and the panelists. If you are inside the YouTube, not to worry, you can also type your question and answer through the interface. All right, so having said that, I would just like to invite our Deputy WHO Representative to the Philippines and also the Acting Country Liaison Officer for Vanuatu, Dr. Rodel Nodora, to please give us some welcome remarks. Dr. Nodora, over to you.
Thank you, Albert. Good morning to everybody. And in behalf of our WHO country representative for the Philippines, Dr. Rabindra Abeyasinge, we'd like to welcome you all to this webinar series that will tackle the subject of workplaces. Workplaces, as we all know, is now a growing area of concern in the overall COVID-19 response of the country. We are happy to see all of you, and we hope that you have come with a mindset of this is how we are going to do things now, given the new normal. With this ongoing COVID-19 pandemic, WHO, in collaboration with the Department of Health, has been analyzing trends on the most affected population. We have noted that COVID-19 infection has been more lethal for the older age groups, which are 60 years and above. But data also shows that the most affected population age groups are those who are in the 20 to 40-year age bracket. As we all know, this is us, the working age group, who are currently the most mobile as we open up more industries and workplaces to also address the economic downturn that we have been experiencing since COVID-19 started this year. Specifically, the prolonged lockdowns that we have been having has greatly impacted the lives of individuals and the economy of the country. And as we continue to reassess and ease some of the non-pharmaceutical interventions that we have put in place, we will also have to anticipate to see an increase in the number of COVID-19 infections. A big player of this increase would be the number of cases that will be coming from the workplaces, since most of the workplaces have started to open up and cater to its clients. We, however, could not prevent the movements of people, especially once quarantine and isolation measures are eased up. We cannot hold on any further the community quarantines that we have put in place since the beginning of this pandemic. This is primarily because of the economic impacts. at all levels of the society that quarantine brings into our lives and that of our country. But health and economy is not mutually exclusive. We can actually find ways to ensure that industries and economies, while they continue to be open, does not and should not be compromising the health of its employees and workers. The business sector can stay open and yet at the same time be prepared for any COVID-19 infection. We need to understand that if we want to be economically viable as a sector, we will need to adjust our systems to the new normal that COVID-19 has brought into our lives. Very similar to the localized community lockdowns that we have been hearing, workplaces can also institute localized closing of sections of the workplace to enable to continue its business while at the same time tackling COVID-19 infection. We must remember that we all have the responsibility of keeping our workplaces open and healthy at the same time. Employers need to ensure that workplace environment is free from harm. Employers have been doing this in terms of instituting measures, but we will need just to readjust these norms in consideration of this COVID-19 pandemic. Relative to to this similar equation are the employees. We will need to also play our part to ensure that the work continues without compromising the health and the situation of the companies that we serve. This 4-day webinar series will provide practical tips for both the employers and the employees on the prevention and control of COVID-19 in the workplace. Specifically, it will aim to identify specific workplace scenarios and recommend customized approaches to beat COVID-19 in the workplace. The webinar will cover what goes on in a day in the life of a worker and his or her workplace or owner administrator. We are confident that the learning that we will have in the next 4 days will ensure that we all can apply it in our workplaces. Let us make use of these opportunities to rebuild our capacities, to create a safe and productive working environment, and to promote sustainable, healthy behaviors, not only in our workplaces, but also in our communities and homes. Do let us know if there are other support that you may need to ensure healthy and safe workplaces. WHO and DOH will endeavor to have adequate and appropriate support to be made available. I wish you all a pleasant learning time today in the next 4 days, and thank you again for all your efforts. Good morning. Over to you, Albert.
Thank you so much, Dr. Rodel Nodora, Deputy WHO Representative for the Philippines and Acting Country Liaison Officer for the Vanuatu Office. Dr. Rodel is, by the way, Filipino, if you are wondering. Nagtatagalog rin po kami. But this is, of course, WHO Philippines, and we would like to welcome everyone. Just to let everyone know, even if the Zoom room is full, you will be seeing a link inside the chat box that now says YouTube link. So if you can share that, that will now bring you to the YouTube link, which is also live. Don't worry, if you are on YouTube, you can still ask your questions using the live chat. If you are on Zoom, you can use the Q&A function at the bottom. Just to let our speakers and panelists know, there are 500 participants inside Zoom and 2,500 inside YouTube. And we're also going to be broadcasting this live on the WHO Philippines Facebook page and also Twitter. All right, without any further ado, I would like to now introduce our speaker for this morning. Our topic is waking up on a workday. So how did you wake up? Kamusta po ang gising ninyo this morning? And to discuss on what can we learn, what can we do rather to prevent COVID-19 infection, even from the moment of waking up, even before we go to the workplace, I would like to introduce to you a dear colleague, Dr. Ivy Nolasco. Dr. Ivy Nolasco is the National Professional Officer for Non-Communicable Diseases at the WHO Philippines Country Office. She is a member of the Health System Strengthening Team. And currently, as most of us have been repurposed, I'm sure we are aware this is a pandemic, all hands on deck. Dr. Ivy is our lead for non-pharmaceutical interventions. If that is a mouthful of a term, wait for her to explain what these non-pharmaceutical interventions are and how these can actually help prevent COVID-19 and keep workplaces open because hashtag this works. All right. If you're going to share this on social media, please use the hashtag so that we can see your reactions. Hashtag this works. Having said that, over to you, Dr. Ivy. You may now begin your lecture. Please share your slides.
Thank you, Dr. Albert. At magandang umaga po sa ating lahat. Let me share my screen.
Okay, I confirm we can see. Please proceed.
Thank you. So it is my pleasure to start this webinar series, which is, by the way, not clinical. So hindi po ito for health professionals. We are hoping that this webinar series would be really practical, and we will take you through your usual working day and see how we, all of us, as individuals, supported by our agencies, our companies, and our institutions, decrease our risk of getting COVID-19, but at the same time as well, avoiding the transmission in our own workplaces. Just a brief overview of the objectives of this session, and also an overview of the content of this session. First is we need to we will identify the risk of getting infected ourselves or infecting others before going to work and while traveling to work. This will entail greater understanding of how COVID spreads and when it spreads, as well as identify the dangerous situations. So when we say risks, kasi these are all dangerous situations or scenarios or settings that increases our likelihood of getting an infection. Second is we are able to describe our own personal protective measures and individual responsibilities to reduce COVID transmission before going to work and while going to work. And lastly, we would also discuss mga patakaran, mga policies, as well as structural and physical modifications that our companies, our employers and managers, as well as our occupational health and safety committee or officers will be putting in place for us to be able to practice our own personal protective and individual responsibilities. So first, we need to understand how COVID is transmitted. So paano ba siya napapasa-pasa or natatransmit sa iba? How SARS-CoV-2 or the virus that causes COVID-19 is transmitted from one person to the next. The most common cause of transmission of COVID-19 is by respiratory droplets. So ano itong respiratory droplets? These are saliva or laway or other respiratory secretions that are expelled when a person coughs, umuubo, bumabahing or sneezes, kahit na nagsasalita lamang, kumakanta, or even while breathing. So kung mangyari ay ikaw ay nasa malapit or you are a close contact of that person who has expelled respiratory droplets, you will be able to inhale directly these respiratory droplets, or these respiratory droplets pwedeng pumunta dun sa mga surfaces, kagaya ng tables, mga frequently touch surfaces, kagaya ng ating cellphones, mga kagamitan natin sa bahay, kagamitan natin sa opisina, at pwede natin itong hawakan pagkatapos ay hawakan natin ang ating mga mukha at pwedeng pumasok siya sa ating ilong at sa ating bunganga. So these are both indirect and direct transmission. So which means that kung malapit tayo at hindi tayo nagmamaskara, then there is an increased risk of getting the COVID-19. But at the same time, if we get hold of commonly touched surfaces and we do not wash our hands, then there's also an increased risk of transmission. Apart from that, there is what we call as microscopic droplets. So kasi yung droplets, iba-iba yung size. So there are droplets that are bigger that fall to the ground almost immediately after being expelled. But there are also smaller droplets that can travel a little further and remain suspended in the air over longer periods of time. Now, these respiratory droplets, microscopic droplets, are mostly generated via what we call as aerosol generating procedures. So ito yung mga usually in the medical settings like nebulization, intubation, extubation, yung mga nag-chest compressions. So that's why aerosols are usually found in the healthcare setting. So there are also studies ongoing that discusses and explores settings that also generates aerosols even outside aerosol generating procedures or in the healthcare settings. Theories such as respiratory droplets are, as well as aerosols are generated through evaporation. Yung normal breathing at saka talking can generate small respiratory droplets and aerosols. And at the same time, if a setting is nakasara, so it's closed without proper ventilation, then a microscopic droplet can travel further than where the person who expelled the secretions are. Second is we also need to understand when is the time that a person is most infectious or can we get infected. So we need to understand the clinical course of COVID-19, clinical course of the disease. First, we need to understand that there is an incubation period. So ano yung incubation period? This is the time of infection until the onset of symptoms. This can vary from 5 to 6 days, even until 14 days. So which means that a person can be infectious even before 13 to 14 days, even before the onset of symptoms. This is followed by a mild phase for around 5 to 10 days. The symptoms are mostly fever, cough, panghihina or fatigue, aches and pains, body aches and pains, and we will also discuss further the symptoms later on in another slide. If the disease progresses, it can progress to acute respiratory distress syndrome or ARDS. This is characterized by difficulty in breathing, mabilis na paghinga or rapid breathing, as well as low oxygen levels in the blood. Now, this can turn to complete resolution. No? Pwede siyang gumaling at pwede ding hindi. So this is the progression of the disease, and a person with mild disease or symptoms can also most of the time also gumagaling din. Now, what we need to understand is that during the course of this disease, the viral load also varies. Now, the most infectious days of a person is 2 days before and 10 days after the onset of symptoms. So I would like to point out that even before the onset of symptoms, even before this time, the onset of symptoms, a person can already be infectious. Pwedeng ang isang tao ay pre-symptomatic, ibig sabihin, hindi pa siya nagkaroon ng symptoms, pre-symptomatic, or pwede rin siyang maging asymptomatic. So kahit nasa total course of the disease, wala talaga siyang na-exhibit na symptoms. Now, the most common way of transmission is through symptomatic transmission. But asymptomatic persons could also infect other people. So do we have a way of saying that this is an asymptomatic or symptomatic phase? So we don't, except if we really test. So that is why it is always better to stay on the side of caution. So which means that I, for example, would always consider myself and others, even if I don't have the symptoms, to have the disease, so that we can all be cautious all the time. Now, we discuss about the risks of infection at home. Now, sabi natin, paano ako magiging infected kung nandito lang naman ako sa bahay? So, paano ba ako mag-infect? Hindi naman ako lumalabas. Okay, so we consider the risk of infections if us, for example, go out, we work, we expose ourselves to other people, but also we take a look at our other members in our households or the other people where we live with. Okay, so paano ba natin ito tingnan? Tayo lumalabas because we need to work, because of essential things. We need to work, we need to buy food, we need to earn a living, etc. So we need to assess ourselves as well as our other members of the household kung ang ating exposure ba outside of the home ay low risk, medium risk, or high risk. So ano po yung ibig sabihin ng low risk exposure, lalo na sa work? So these are the work or yung ating mga lakad kung saan wala tayong frequent na close contact with the general public, visitors, or even clients when we go to work. So low risk tayo doon. Medium risk tayo kung ang ating trabaho ay parating nakaharap tayo sa ating mga kliyente, sa general public, at saka marami tayong bisita at we entertain a lot of our clients. Yung high risk talaga na exposure are really those who are in close contact with suspected or even confirmed cases. So these are people in the hospitals, people driving vehicles that are carrying patients, and also those who are also managing dead bodies. So ito yung mga pinaka-high risk to exposure. So we need to assess ourselves at ating mga kasama sa bahay kung high risk ba sila, at the same time, have we taken steps to be able to avoid the transmission within the household by maintaining physical distancing, o kung hindi naman posible is mag-wear ng mask, as well as the other protective measures such as frequent hand washing, respiratory etiquette, etc. Second is that we get exposed because of visitors or because of gatherings. So it is also important that as much as possible, personally ako ay as much as possible iniiwasan ko yung gatherings, at kung meron mang bisita, kailangan i-assess ang risk. At the same time as well, kailangan i-orient yung ating mga bisita kung ano ang gagawin. Now, just general set of reminders before we go directly to the preparations for workplaces. Each of us has the responsibility to take care of each other within our households, but also the head of the household or the one managing the household should also be able to set household rules and reminders. So ano ba itong mga household rules and reminders? Now this will be further discussed in session 4 on the 4th day going home from work. So I will not be discussing this even further, but just a few tips, especially for the heads of the household or those that are managing the household. Number 1, if we have with us in our household people who have medium risk or high risks, or even low risk because we don't know the risk, especially if people go out, is really to, as much as possible, practice physical distancing, and if it's not possible, we need to wear masks. Physical distancing is very much needed, especially if we have people who have vulnerabilities, such as people with old age, as well as comorbidities. Kung meron silang ibang sakit, that will increase their risks of severe infection. We need to put in place reminders so that people will be able to practice regular hand washing, cough etiquette, as well as frequent cleaning and disinfection of frequently touched surfaces. We need to ensure as well that our place, our house has good ventilation. We need to open our doors and our windows para makapasok po ang hangin. And also, we need to set rules and precautionary measures for visitors, and as much as possible, we need to avoid gatherings. Kung meron mang gatherings and we cannot avoid it, then we set some precautionary measures and preventive measures for that. Now we go to, and at the same time as well, if, for example, if we have in our household someone who has high risk work or high risk for infection or exposure, if it is possible, then we need to designate a space for someone to self-quarantine, para just to be sure that the rest of the family members or in the household are not able to contact the disease. Now, what are the preparations for us before going to work? So hindi tayo paggising, dire-diretso na natin gagawin yung wala tayong iniisip, no? Kundi the preparations and the preventive measures for COVID-19 and even other infectious diseases starts immediately after we wake up. Okay. First, if it's not really possible, if we have coexisting diseases, and if it's not really possible to, if it is high risk for us to expose other people, then maybe it would be better for us to apply or discuss with our managers alternative work arrangements. Okay? So if it's not really possible for us to get in, to have ourselves exposed, so mas magandang we need to talk with our managers to apply for alternative work arrangements. Second is we need to check if our mask and our hand sanitizers are in our bags or in our packets, so that we are able to bring the hand sanitizers with us during our trip or our travel. Third is we need to plan our route or our route and the mode of transportation. Ano ba yung pinakamas madaling o pinakamalapit na ruta papunta sa ating trabaho? Ilan ba ang ating masasakyan? Gaano ba karaming tao ang sasakay sa ganitong ruta? Ano ba ang sasakay ba ako sa jeep? Ang jeep ba na ito ay merong mga preventive measures? Pwede ba akong makapag-physical distancing, etc. So kailangan nating planuhin ang ating ruta as well as our mode of transportation. Now this will be, the mode of transportation and the route will not be a problem if our employers will provide our transportation for us. The last one is we need to assess ourselves for symptoms as well as the risks for getting the disease. And afterwards, after our risk assessment, we need to report to the authorities when needed. So paano ba siya yung assessment na to? So paano ba itong self-assessment na to? So this form is just an example of a lot of the assessment forms that are now being used. But if we take a look, there are two main parts for that self-assessment. So which means that kung sasabihin nating self-assessment, hindi po natin ito gagawin at the doorstep of our workplace. We need to do the self-assessment even before going out to work. So i-check natin, number one, we need to check for symptoms. The most common symptoms are the top three. So fever, dry cough, pagod na pagod ka, body pains, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, and loss of taste or smell. So these are the common symptoms. After checking our symptoms, we also need to assess our risks. So ano ba yung risks? Exposed ba ako sa isang tao na posibleng may sakit or confirmed na may sakit? Kaya importanteng on the previous days, we need to check and we need to take note of the people that we are with para alam natin if something happened to them, then we can also follow up and confirm kung ano bang nangyari or nagkasakit ba sila o hindi. So it's really important for us to assess our risk of exposure.
Yes!
Like for example, meron akong kakilala for example na nagsabing yung posibleng yung aking nakausap nung isang araw nagkasakit siya. Pumunta siya sa hospital. Nakausap ko siya nang matagal, magkasama kami, inalis ko ang aking mask, at saka kumain kami ng kasabay. So tapos nalaman kong nagpa-check siya. So anong gagawin ko? I am close contact. So kung close contact ako at alam kong posibleng may sakit siya, posibleng mataas ang risk na ako rin ay na-expose at ako rin ay nahawa. So as much as possible, we need to recognize our symptoms and our risk. So not only an exposure to a particular person, but also a history of travel to an area where there is high transmission of COVID. So after this assessment, what do we need to do? When in doubt, no, kahit na isang symptom lang, kasi minsan mild, hindi natin iniintindi. Okay, so mild lang naman, konting ubo lang naman to. But there are a lot of instances of workplace transmission that happen because people binaliwala yung isang konting sore throat or ubo o kahit na mild fever. So when in doubt, stay at home. And afterwards, contact your company doctor or your occupational health and safety officer. So it is always important to stay on the side of caution. So ito yung main message sa slide na ito. When in doubt, even with just one symptom, stay at home, contact your doctor, and contact your occupational safety and health officer. Now, during travel, lumabas na tayo sa bahay. So ano ba yung risks of infection during travel? Meron tayong tinatawag na 3 C's. No? So this is not only during travel, but we can assess this when we go outside and we go to different places. So ano ba yung 3 C's? Number 1, yung crowded conditions. So kung ang ating sasakyan or during the time of waiting, maraming tao. So this is one risky scenario or risky situation. Second is when we stay during travel in closed spaces na kulang ang ventilation or flow ng hangin. Third is when we have conversations magkalapit in short distances. So if these conditions overlap, the more of these conditions overlap, the more risky the situation. Okay? So as much as possible, when we do travel, we need to assess for 3 C's: crowded conditions, closed spaces, as well as no physical distancing. Now, how can we protect ourselves and what are our responsibilities as individuals during travel? So number 1, when we travel, especially when we use public transport, we need to assess if there is enough physical distancing. So even while walking, so we need to maintain physical distancing and avoid crowded areas for transportation. When we ride our bus or when we, for example, when I ride a taxi, for example, I ask the driver to open the windows. So this is to allow increased ventilation and airflow. We need to wear our masks properly. Okay, so meaning hindi po nakababa, hindi po naka-expose ang ilong at hindi po ibababa sa chin. Okay? And then as much as possible, refrain from talking, refrain from eating during the transportation. And there are policies in the transportation offices that says no talking, no eating, and no talking, no taking phone calls, because it will aside from increased droplet transmission, it also influences you. It will also to take off your mask. Okay, so as much as possible, refrain from taking off your mask and wear your mask properly all the time. Sanitize your hands after touching the objects, like touching the doors, and sanitize your hands often. And lastly, going to and going back from office, we need to avoid going to multiple destinations. Okay, so kung mas maganda, kung papuntang opisina, papunta lang, pabalik galing sa bahay, diretso na sa bahay. This will limit our exposure to other people. So as much as possible, we need to plan where we go. And when we do go to to buy supplies, for example, we need to schedule that so that we will not have multiple destinations. Now, what are the responsibilities of management of our employers, our managers, as well as our occupational safety and health officers? Okay, so ito yung mga posibleng polisiya at mga measures that needs to be put in place so that every one of us will be able to practice personal protective measures as well as our individual responsibilities. Number one, we need to, there is a need to operationalize a system for individual risk assessment and screening. So di ba kailangan natin sa bahay pa lang, we need to assess ourselves when it comes to symptoms and risks. So it is important that this will be institutionalized. I visited the hospital, for example, that required all their employees to self-assess online before going out of their house. So it's always important to put in place that system of regular risk assessment and symptom screening even before the employee goes out of the house. When I say individual risk assessment, it is also important to assess the risks of an individual in contracting as well as getting severe COVID. So like for example, in our work setting, even if we have the same work setting, there are many jobs and different responsibilities that will have different risks. So in risk assessment for individuals, for example, the company needs to consider the environment, needs to consider the task of that person, needs to consider the threat, the available resources, and also needs to consider the age as well as the pre-existing medical condition of that employee. Secondly, there is a need to establish as well a system of self-reporting and referral. So if the employee or even the employer in the company after self-assessment needs to refer the condition to someone in authority. So it is important to have that reporting and referral system in place. So this will assist the individual to be able to decide on the next steps as well as assisting them to get proper care. So apart from the things that we need to establish so that individuals can practice personal protective measures even before going out from home, during transportation, it is important that non-essential travels are canceled or postponed. Mas magandang kung ano yung pinaka-importante na talaga na travel ang kailangan gawin. If you cannot avoid the travel because it is work-related, then afterwards that individual needs to consider the risk as well and observe himself for symptoms assisted by the company as well. It is important to provide transportation if possible because if we provide our own transportation, then we are in control of the situation as much as possible. Then yung iba-ibang tao sa iba-ibang lugar ay maiiwasan. So we are able to put in place as well inside the transportation protective measures like adequate physical distancing, installation of barriers when needed, windows opening, and policies for proper mask wearing, as well as non-talking, as well as non-talking to the phone, so that we are able to control our passengers. It is also important to provide, and so that people are encouraged to sanitize their hands, to provide hand sanitizers at the entrance of the transportation, and also at the start and at the end of the day to do routine cleaning and disinfection of the vehicles. If it is used frequently, then the cleaning and disinfection should be more frequent. So as take-home messages for this session, number one, we need to perform our self-assessment. So that is our main responsibility before going out of the house. Second, we practice personal protective measures. And third, we follow workplace policies. The prevention and the control of the transmission of COVID-19 in the workplace begins at home, continues as we travel to and from work, and is the responsibility of both employees and employers. Keep our workplaces healthy and safe. Thank you and have a nice day.
Thank you so much, Dr. Ivy. If you could please unshare your slides now. So we will go to, right. So maraming salamat, Dr. Ivy Nolasco. Thank you so much for delivering the lecture for this morning. So the time is 11:40. There are 500 participants inside the Zoom room and 3,636 on YouTube. And I understand from our colleagues, we are being broadcast live also on the Facebook page of WHO Philippines and also on its Twitter pages. So before we go to the moderated open forum, I would like to remind everyone, it is best to ask your questions. If you are inside the Zoom room, there is a button sa baba. There's a button down there that says Q&A at the bottom. Hello, DG. Magandang umaga po. I just saw DG Plaza. Just welcome. Welcome po. We will call on you later, ma'am. So
Sure.
There's a Q&A button at the bottom, and you can type in your questions there. If you see a question that is interesting that you'd like to also ask, you can always click the upvote, the thumbs up, and then the moderator, that's me, will see it ahead of the other questions. For those of you in the YouTube link, wag po kayong mag-alala. You are still live with us. Nakikita po namin, ang dami nagchat-chat. Yon, si Melanie Macasero said, "Thank you, Ma'am Doc Ivy." I just had to mention that to prove to you that we are actually monitoring also the YouTube side of things. So we will now turn over first to our panelists. I'd like to introduce Undersecretary Irineo Bismonte of the DTI. With a career spanning nearly 4 decades of uncompromising public service, Undersecretary Irineo Bismonte rose through the ranks from his start as a trade and industry development analyst to become the chief of staff of DTI. He now heads the DTI Management Services Group, supervising 6 service offices, namely Planning and Management Service, Financial Management Service, Information Systems Management Service, Knowledge Management and Information Service, and Resource Generation and Management Service. As Chief of Staff, Yusek Bismonte supervises the Office of the Secretary, which includes the Foreign Trade Service Corps, Public Relations Unit, and coordinates with also other DTI offices and attached agencies and corporations. Yusek Bismonte also serves as the Secretary's alternate representative to the Interagency Task Force, or IATF, on emerging infectious diseases. Yusek Bismonte holds a Bachelor of Science degree in Agricultural Engineering from the University of the Philippines in Los Baños and a Diploma in General and Strategic Management from the Maastricht School of Management in the Netherlands. Known to be an ingenious and firm leader, he makes sure that the DTI innovates with the times to best deliver its brand of serbisyong higit pa sa inaasahan. Yusek Boy Bismonte, you have the floor po for your initial intervention, sir.
All right. Good morning, Albert. Thank you very much for that introduction. Good morning, DG Plaza. Good morning to our resource person, Dr. Ivy Nolasco, and to other members of the panel. Good morning to everyone. Isa pong mainit na umaga sa ating lahat. Thank you for the opportunity to join this panel. Very timely, as you know, DTI is very much into uh, pushing for more business activities to open at this time of the pandemic. Very much needed now, considering that we're into several months already in quarantine. And very timely for this workshop for workplaces, in particular for locators of the Philippine Economic Zone Authority. As mentioned by our resource person, we need now to coexist with the virus. We cannot stop them now, but we have to live with them. And the best way to live with them is really to practice the most important. The important is we don't let the guards down. We continue to wear masks. We observe physical distancing. We frequently wash our hands, and and of course report and be cautious of what we are going. We are talking to. We are interacting with our colleagues or with our friends. So for this morning, before we proceed with the panel discussion, I'd just like to highlight the importance of the prevention. And prevention, as we mentioned, is at this time we need our people to have that behavioral change in being conscious about wearing mask, washing hands, and observing physical distancing. Uh, Maybe our workplaces should be able to communicate this to our people. Sometime I remember sometime a month ago, together with Migo here, we have this survey among workplaces, and it's strange that or surprising that in the survey, this is basically a based on what they think, the employees think, is that there is a low compliance to this non-pharmaceutical intervention, wearing of mask, observing physical distancing in the workplaces. And I think this is very timely that this change, this behavioral change should be monitored. And I think this should be one of the dashboards that workplaces should be able to observe and monitor. So this is a change that we have to be cautious, be able to communicate to our employees, not only in the workplaces, but as mentioned by Dr. Ivy, starting from our respective houses, going to office, using the uh, transportation means to go to the office. We have to be conscious about the wearing of masks, the physical distancing, and the washing of hands immediately after when we reach our respective offices. And other than prevention, by the way, this is the most important aspect, prevention, because if we can prevent this, then we don't have to go to the other aspects of reducing COVID-19 and preventing deaths. The next important elements are the detect, isolate, treat, and recovery. In all this, prevent, detect, isolate, treat, and recovery, we think that the workplaces, the employees have a very important role in one, in reducing transmission, and number two, in providing a better health capacity system, and number three is in mitigating the social impact. So with that, I end my opening statement and solicit comments and observation from everyone. Thank you.
Thank you, Yusek Vismonte of the Department of Trade and Industry. Wow, so ang kita po natin, no, talagang it doesn't take a health worker, it doesn't take a DOH official to actually join in this fight against COVID-19. We're all in this together. In fact, kung di po kayo nagugulat, why is the World Health Organization and PEZA of all institutions are working together? Because this is not about being a health worker, this is about being together to beat and control COVID-19. Having said that, just a reminder, there are 500 inside the Zoom room and hinahanap ko po yung number sa ating YouTube. Ayun, 3,536 watching on YouTube. So we have over 4,000 participants live and alive, and ang dami na pong questions. Sisimulan ko lang po muna sa mga housekeeping questions. Favorite question number 1, magkakaroon po ba kami ng certificate mula sa webinar na to? Hindi po kami nag-i-issue ng certificate, pero sana po yung pong ating knowledge and practices na based naman rin sa ating guidelines, DTI, DOLE, and WHO and DOH guidelines, sana po makatulong sa inyong daily operations. Ngayon po, favorite question number 2, pwede po bang humingi ng slides ni Doc Ivy? Ang answer po is wag po kayong mag-alala. We will be sending out the slides at the end of the day. Ang style po natin, sinasadya namin, medyo para masabik-sabik kayo ng konti, mamayang hapon po natin ipapadala. But not to worry, this is already recorded. So even after we end the webinar, you can see the YouTube link and it will already be shareable instantly, even on social media. Use hashtag #thisworks. And having said that, ito na, actually iniiwasan ko yung mga questions kasi medyo maisip siya. Doc Ivy, Yusek, Boy, DG, if you'd like to also answer, and also Dr. Rodel and Dr. Migo, of course, please feel free to join in. Oh, by the way, speaking of Doc Migo, apologies for not introducing our youngest but also very capable panelist here, Dr. Miguel Angelo S. Mantaring, or Doc Migo, graduated Doctor of Medicine from the University of the Philippines College of Medicine in 2016. He served as a doctor to the Barrio and Municipal Health Officer of Itbayat, Batanes for 3 years. Doc Migo obtained his Master's in Public Management, major in Health Systems Development from the Development Academy of the Philippines, and he is now a medical officer in the Health Promotion Bureau of DOH. Thanks for joining us, Doc Migo. So I'll be calling you as the questions come in. Isa pong paalala, this is a webinar series. So marami po tayong mga tanong na maaaring hindi masagot sa araw na ito. It might not be covered for the topic today, which is what to do when you wake up, di ba? When you wake up in the morning and go to work. It's all about prevention for today. But stay tuned tomorrow on on Thursday and Friday kasi meron po tayong coverage according to the pathway of a worker going to work, working inside the venue, going back home, and what happens if a worker gets sick. Simulan natin siguro, hinahanap ko actually, kaya nagdadaldal lang po ako, I'm just buying time, because there are related questions on testing. This is supposed to be a question for Thursday, Doc Ivy, but I think because you mentioned about self-assessment, Doc Ivy, are you still there? Can you show your video, please? Doc Ivy? Just yawn. Ayan po, si Doc Ivy, kung napapansin niyo po yung kanyang background, siya po ay nagmamaneho ng isang bus ngayon. Well, so Doc Ivy, yun kasing question, one of the favorite questions, how often or should we even test an employee before returning to work? Kasi di ba, waking up and going back to work eh. And related to that, is there use for a rapid diagnostic antibody-based test? Doc Ivy, over to you.
Thank you, Doc Albert. Okay, so ang importante po bago pumasok sa trabaho, it's really symptom screening and risk assessment. So ibig sabihin nun, base dun sa resulta ng symptom screening and risk assessment, that's the time na mag-decide if you do the test or not. The recommended test is not rapid test. So it's always the gold standard is RT-PCR testing. So wala pong lugar ang rapid testing sa screening. So once again, just to emphasize, that before going to work, what is really important is to assess if there are symptoms as well as risks of exposure.
Thank you, Doc Ivy. At since pinapakita na natin yung van na sinasakyan mo yung bus sa picture, meron po tanong dito, Doc Ivy, and maybe I'll also ask Yusek Boy to chime in after Dr. Ivy, no? How many are allowed? So Irene Sevilla is asking, how many are allowed to ride in a service van? Paano ba natin manilaman ilan nang sasakay sa loob ng isang service van? Doc Ivy and then Yusek Boy, please.
Siguro depende sa size ng van, ano? Basta ang importante is the physical distancing is really possible. So meaning that the distance should be enough, more than 1 meter, 1 meter or more ang distansya ng bawat isa. At the same time po, hindi po yung close ang pag-uusap. So it's really the transportation should allow proper physical distancing.
Yusek Boy, any comments on that?
Yes, Albert. Nabasa ko rin yun sa mga advisory ng Department of Transportation, that sa mga bus po, halimbawa, in a row, 2 or 3 lang, o may mga vacant seats in between. And I think hindi lang po dito sa physical distancing sa bawat transport, kundi yun pong ventilation. Kasi nabanggit din po yan ni Dr. Ivy na mahalaga yung ventilation kasi dapat umiikot po yung hangin sa loob para hindi po na nagtatagal. And ito po yung isa sa mga pwedeng makaiwas talaga ang pag-contaminate ng hangin at maiwasan, especially during transport.
Thank you, Yusek Boy. No? And having mentioned that, so actually nasagot na yung tanong ni John Brian Cafe. Sabi ni John, is riding a public transport with a non-air-conditioned bus much safer than the air-conditioned bus? And as we heard from our panelists, yes. Mas safer po yung open air sa ngayon. Wag muna natin pag-usapan yung air pollution kasi ibang usapin po yun. Pero as far as COVID-19 is concerned, mas safe po yung open air. Meron pa tayong isang related question at siguro I'll ask Dr. Migo for input on this. Meron tayong isang attendee nagtatanong, if the enclosed area like the vehicle can have microscopic droplet transmission, lahat po ba ng kasabay or kasakay sa loob ng vehicle ay magiging close contacts na kung may mag-confirm na positive sa loob ng sasakyan? Doc Migo, any comment on that?
Yes, thank you, Dr. Albert. No, so in our DOH guidelines, we have very specific definitions for who falls under a close contact. So there are 3 parameters na you must at least spend more than 15 minutes with this person. You have had direct contact with this person, and as well as the being in a enclosed space nga po, no. Pero among these highlighted points of defining a close contact, every specific definition falls closely with the minimum health standards or these non-pharmaceutical interventions. So as long as you as an individual are following these minimum health standards or non-pharmaceutical interventions, then you are assured that you do not fall under these definitions of being a close contact.
Thank you, Doc Migo. So I'm browsing through the questions. So ito it's a reminder na hindi tayo matatapos today. Today is just prevention. Bukas po, at tinitignan ko ang aking kodigo dahil ang dami talagang information. Tomorrow, Wednesday, we will be discussing yung mga questions tungkol dun sa mga filter na ginagamit sa office, pag binuksan mo yung bintana sa office. Kasi bukas pa tayo darating sa opisina. Nagigising pa lang tayo ngayon, naguhugas pa lang tayo ng mukha natin. At sabi nga ni Doc Ivy, we are checking our symptoms. And Doc Ivy, ito siguro yung isang tanong mula kay Edmer Fabian, which is pertinent. No? Sabi ni Sir Edmer, if a person is asymptomatic and was not tested, is it possible that he or she stays that way for long? Kasi di ba, bagong gising, wala naman siya nakitang simptomas. So ano ba yun? Baka pwede bang may COVID siya? And related to that, is there any study or information of asymptomatic people being such for a long time and then becoming immune later on? Pwede ba yun, Doc Ivy? Summarize ko na para bang dinapuan na sila ng COVID, wala silang simptomas, tapos wala, natapos na. Is that possible, Doc Ivy?
First, we need to understand the limitation of the information that we have. Why? Because we don't routinely test the population in general, so we don't have enough information on asymptomatics. So which means that when it comes to the length of the infection, the length of the virus inside the body, we're not really definite yet because we still lack the information. Having said that, uh, a person who is asymptomatic, who has COVID-19 but doesn't have symptoms, may still possibly infect others. So that's why we all the time when we go out, when we go to work, when you ride public transportation, and even at home, when we have the risk, we always lean towards the side of caution and always practice the minimum public health standards.
Yon. So ang sinasabi po ni Doc Ivy, kahit gustuhin man po naming sagutin lahat ng tanong, kahit sino pong scientist sa ngayon, hindi pa hawak yung kompletong information. Pero ang pangako po namin sa inyo, as soon as the information is available, DOH, WHO, PEZA, DTI, DOLE will definitely, alam nyo, ang bilis mag-update ng DTI tsaka DOLE and PEZA ng guidelines. Yung pong bagong labas na August lang, actually pinag-uusapan pala ni Secretary Lopez, kinabukasan lumabas kagad. Tapos ito na, nag-webinar na tayo. And brings me to an important question. Ito na, kasi nga going to work yung pinag-uusapan eh. So meron tayong nagtanong na anonymous participant. Sabi niya, when a COVID positive individual resumes work, so I'm assuming gumaling na to, no? COVID positive and then recovered individual resumes work. How safe is his or her co-workers when exposed to this individual? Doc Ivy, no? So remember, this is an individual na nag-positive, nag-recover na, declared as recovered na, at pabalik na sa work. Safe ba siyang makasama sa canteen, Doc Ivy?
Okay, so pag sinabing recovered na siya, so ibig sabihin wala nang risk for infection nun. Kasi nga cleared na siya to go back to work. Okay, so having said that, yun din, kahit na nga cleared na for infection, we always maintain our minimum health standards because we still have limited information as well for the infection, etc.
Doc Migo, speaking of recovery, alam ko favorite question sa DOH to eh. I hope you can also shed light on this, no? Kasi yung bang recovery, meron bang basis yon? Talaga bang totoo na kapag lumampas na nung 14 days na isolation, hindi na nakakahawa? Kahit nagpa-positive pa rin sa PCR? Kasi we are seeing here a question, what would be the next steps for those who were swab tested and then positive, and then they completed 14 days quarantine following DOH guidelines, and then another swab test was done, hindi to RDT, swab to, tapos positive na naman siya. Doc Migo, paano ba yun?
Yes, so this is a very common question we encounter. So we also just like really to emphasize po na no diagnostic test is 100% specific and sensitive po. So there are really some diagnostic tests which will give a result contrary to what is really happening po. So having said that nga we do the 14 days, we do the symptoms based clearance already, because based on current evidence worldwide as well, which we have patterned from recommendations from the Philippine Society of Microbiologic and Infectious Diseases as well as the Philippine College of Physicians, that a person is no longer infectious after his 10th day of sickness po, no? And adapting it into DOH guidelines, we extended this into 14 days just to make sure na covered na po lahat ng bases natin. So this is really, we just reiterate and re-echo the recommendations from our experts and worldwide evidence with regards to this po. No? And what we know with the virus, that it's transmitted through respiratory droplets. So if a person is recovered, as long as wala na siyang symptoms, then really the risk of infecting another person is very low.
Thank you, Doc Migo. No? Meron akong ngayon, so ang oras po natin ay, parang radyo na tayo, ang oras natin ay alas 12:03 ng hapon, 12:03. At sigurado po akong marami nang nagugutom, pero kitang-kita pa rin na meron pa rin tayong 500 participants sa Zoom at 3,362 sa YouTube. Mukhang gutom pa rin ang ating mga kababayan para sa impormasyon on how to prevent COVID-19 even before going to work. Ang daming ang tanong, nasa workplace na eh. So ito pong next question natin, na-pick up ko po sa YouTube. Sabi ni ang kanyang nickname, Jiki1978. In self-assessing, if there is only one symptom observed, do we need to stay home immediately or should there be a number of symptoms? Nagbibilang ba tayo ng symptoms? Kasi pinakita ni Doc Ivy kanina yung DTI DOLE checklist. So bali, Yusek Boy, I will also pass the question to you after Doc Ivy. Meron kasi tayong DTI DOLE, para bang bullet points, no? Ito yung mga symptoms. May isa pa palang question, Doc Ivy, you might also want to answer. Kasama na pala ang conjunctivitis sa symptoms na to. So ulitin ko yung question, no? kasama na pala ang conjunctivitis? And number 2, meron ba tayong binibilang na number of symptoms bago ako magstay at home? Or wala pa naman ako sa score na 5, pasok pa rin ako sa office? Doc Ivy?
Thank you for the question. Yung conjunctivitis, isa sa mga symptoms na hindi common. So ang pinaka-common talaga, yung fever, yung dry cough, at saka yung panghihina. Okay? Aside from the sore throat, etc.
Doc Iril, yung conjunctivitis, paliwanag natin sa mga kapatid natin na hindi doktor?
Yung parang sore eyes. Parang siya yung sore eyes. So, sore eyes talaga sa conjunctivitis. Okay, so hindi po tayo nag-a-assess. Although we do our self-assessment, what is important is that after we do our self-assessment and we do identify symptoms that are possibly related to COVID, we need to talk to our doctor. Okay, so they are the ones who will help us assess the risk. Sa akin personally, as much as possible, even one symptom, hindi ako makukumpiyansa. No? Kahit isang symptoms, because there are a lot of instances wherein a person goes to work kasi, ay, this is just a simple, very simple mild cough. But then this person becomes the carrier of the disease and spreads the virus in the workplace. So we do, hindi po natin dapat baliwalain even the mild symptoms.
Yan. So remember, no, i-echo ko lang, wag baliwalain kahit medyo nangangati lang yung lalamunan, medyo may konting sinat. Kaya tayo, sabi nga sa slides ni Doc Ivy, call your occupational and safety health officer. Wala naman po mawawala kung tumawag tayo or magsabi tayo. Yusek Boy, any comments po on using the symptom checklist of the DTI-DOLE joint memo?
Yeah, tama po yan. Meron po tayong same understanding kay Dr. Ivy, that hindi po kailangan magbilang. Meron lang po tayong isang simptomas na nakita. Ito po ay pwede na nating sabihin na mag-ingat po tayo. At sabi nga ni Doc Ivy, ang pinaka-the best is really when in doubt, di ba? Huwag muna tayong pumunta sa office. Pero siguro ito po mahalaga yung mahalaga yung koordinasyon ng workplace, particularly nito mga safety officer at mga empleyado. Kasi ayaw rin naman natin na magkaroon ng hindi kailangan na absenteeism. So gusto natin na talagang valid yung pong pag-absent ng tao at meron po siyang nararamdaman.
Thank you, Yusek Boy. So ang oras natin ay alas 12:07 ng tanghali at nakikita po ko, ang dami ko talagang question. No? Mag-run through lang ako sa questions para may preview tayo dun sa mga darating na araw. No? Yan, sabi ni Maria Filipinas Cabana, how about the risks of online transactions, deliveries of food? Yan. May nagsabi dito na anonymous, how many COVID-19 cases bago ipasara for sanitation ng office? Gaano kadalas ba dapat linilinis ang aircon? Talagang practical yung questions, no? And that's most welcome. Evangeline Dionisio, paano ba binibilang ang 14 days quarantine? Si Ruben Go, bakit nawawala yung panlasa? Why do we lose the sense of taste and the sense of smell? How is the virus affecting these? Tas meron ito, ayan, given that our office already puts in place physical distancing and mandatory wearing of face masks at all times, can we opt out on wearing face shields? Wait, teka, sige, magpo-pause ako dito. Ito medyo magagamit natin. Doc Ivy, I will repeat the question. Given that our office already puts in place physical distancing and mandatory wearing of face masks at all times, can we opt out on wearing face shields when not interacting with colleagues or visitors? Alam ko para bukas po to, pero I'm sure hot to eh. Doc Ivy, please. And then I'll ask Yusek Boy.
Meron kasi tayong policy ngayon, no, sa public places as well as workplaces. So hindi ko masasabing can we opt out on wearing face shields because there is a policy on that. Just want to emphasize that the more yung kombinasyon kasi ng iba-ibang preventive measures decreases your risk of getting the disease. So meaning that it is not just the mask, it is not just the face shield, but also proper physical distancing, hand washing, all in combination will further decrease your risk.
Yusek Boy?
Yeah, tama yan, Albert. Nalagay po natin yan sa DTI-DOLE guidelines, that kailangan na yung mask together with the face shield ay dapat ginagamit natin. Particularly pag meron tayong interaction sa ating kapwa empleyado or with our clients. Pero ito naman pong face shield, pwede po nating tanggalin kung halimbawang hindi po praktikal doon sa ating trabaho. Halimbawa, kung kayo po ang trabaho nyo sumilip ng telescope, hindi naman ho talaga pwedeng ganyan. O kaya nananahi po kayo at naaabala yung inyo pong pananaw sa inyong trabaho, hindi naman po ganon. So malinaw po yan sa ating guidelines na mayroong mga sitwasyon that inaalaw naman po natin na gumamit ng face shield. Ang ganda ng face shield mo, Albert.
Thank you, Yusek Boy. So kung mapapansin niyo po, impractical para sa isang webinar moderator na wala namang katabi na mag-face shield. So I think this is to emphasize, alisin ko lang po kasi hindi niyo na maririnig ang boses ko. This is to emphasize the point that, as Doc Ivy said, additive siya, dumadagdag. So yung physical distancing, yung washing ng kamay, tsaka yung pagsuot ng face mask, dun pa lang panalo na. Kapag naglagay pa ng face shield, parang dumadagdag pa. Pero kung sa trabaho nga natin, nagmamoderate ng webinar, wala namang katabi, o kaya nag-welding, totoong welding, hindi porke mukhang welding yung face mask, pwede nang gamitin sa welding. So we have to customize based on our situation. Ang oras natin ay alas 12 gis na, and I think this is the time when I will ask the last question. At ito medyo mabigat to, parang pang Miss Universe Doc Ivy yung tanong. Ang tanong ni Stella Maris Gonzalez, what are the best practices in improving compliance in minimum health protocols? Siguro si Doc Ivy and then si Doc Migo ang tatanungin ko dito, no? What are the best practices in improving compliance in minimum health protocols? Paano ba natin gagawin yung mga yan, Doc Ivy?
Kasi itong improving compliance on minimum health protocols, parang behavior change to eh. So parang behavior change siya. So ibig sabihin, kung behavior change siya, it's a combination of your personal resolve, your personal knowledge, and your personal resolve, but at the same time, it is also contributed by an enabling environment. So kaya tayo during sa ating webinar series, pinag-uusapan natin yung individual responsibilities, but at the same time, kung ano yung responsibilities ng isang kumpanya or responsibilities ng managers or yung occupational safety and health officer, para both ay magko-combine. Yung personal resolve mo to practice the personal protective measures, but at the same time, that conducive environment for such.
Nabanggit mo, Doc Ivy, no? Behavioral change at kasama yan sa health promotion. Sakto pala na si Dr. Migo Mantaring from the Health Promotion Bureau ang ating pakomentan. Paano ba natin gagawin yung behavior change na yan, Doc Migo?
So thank you, Dr. Albert. And just to also re-echo what Dr. Ivy said, no. So we're here at the webinar now discussing what we do before going to work. So this is a very personalized setting, no. So this is why individually we need to take command na of our own protective behaviors against COVID. So, which is why in DOH, we also launched our BIDA campaign. No? So, BIDA Solution Laban sa COVID-19. So, simple mnemonic lang siya, which can be used in any setting which you are interacting with as an individual. So, B, bawal walang mask. I, isanitize yung kamay, iwas hawak sa mga bagay. D, dumistansya ng 1 metro. And A, alamin yung totoong impormasyon. So we know that this battle against COVID has many front lines, no? May front lines sa hospital. Our health workers are working tirelessly to ensure na they're able to treat, no, these people with COVID. Pero the one front line we often overlook is the front line of our own households. So dito, tayo talaga ang nangunguna sa laban, no? There are only 1,000 hospitals in our country, pero there are more than 20 million households within our own country. And just imagine na if at an individual level we can practice these self-protective measures already, then we really have no problem or worries of transmitting the virus elsewhere.
Thank you, Doc Migo. No? Ang ganda ng sinabi mo. No? There are only 1,000-something hospitals, but there are 20 million households. And there are still 3,700 participants in this webinar. And they're all learning from us on prevention, which brings me na po to the last part of our webinar. Wag muna kayong mag-log out dahil nandito na po si Director General Charito Plaza of the Philippine Economic Zone Authority. Ma'am, over to you po for your remarks or comments po on this first day of our webinar series, ma'am.
Yeah, thank you. Good day, everyone, our speakers, our panelists, and our participants. This is indeed a very timely 4-day webinar series. Very timely because it conforms with the PESA's balancing acts, no? Of protecting the health, the jobs, and of course the economy. So we are very happy to inform everyone that out of the 1.6 million directly employed in our 408 economic zones and 4,586 companies, um, only 1,469 were hit by COVID and 3 deaths. So this is because of our very strict requirement for the eco zones and the companies to regularly disinfect their premises. And so we also impose strictly the skeletal force only who are provided with um, strict use of PPEs, of course, and we provide them also the shuttle services and the housing facilities. And we increased the work from home ratio from the usual 30%. We are now increasing this to 90% can be work from home. So as a result of these balancing acts of PESA, 85% of our companies in Luzon are operational. 78% in the Visayas companies of PESA are also operational, and 90% in the Mindanao ecozones are operational. So we want to continue with this perception, this image that investing in PESA's economic zone is worthy because we assure not just our investors but our workers that our PESA ecozones are COVID-free. So with this, I would like to thank Dr. Rabendra Singhe, our representative of the World Health Organization in the Philippines, for the WHO's continued support for a healthier economic zone. So PESA and the WHO's partnership actually started in November 2018 when we launched the Revolution Smoke-Free Ecozone. And we started this in our Baguio City Economic Zone, which aims to reduce the incidence of non-communicable diseases in economic zone workers, which is brought about by smoking and through the inhalation of secondhand smoke. So in less than 2 years later, PESA has sought the assistance again of the WHO's team, this time to minimize, if not prevent, the transmission of SARS-CoV-2 virus in our economic zones. And through the tireless effort of Dr. Ante Trinidad, thank you, who has been assisting PESA in the past 2 years, Ms. Ava Batayan, Dr. Albert Domingo, and their in-house experts, which include Dr. Ivy Nolasco, Dr. Raj Yadav, and Mr. Harold Dorotio, they were able to craft this very timely program in less than 2 weeks. So thank you, and our deepest gratitude for your sincere efforts and hard work in making the workplace and the communities safer by emphasizing best COVID workplace management practices and drawing attention to areas for improvement. Considering the evolving nature of the science and the interventions needed to address this pandemic, we hope that this activity will not be the last. We will continue to work with the WHO, with DTI, with the Department of Labor and Employment, and other partner agencies in the IATF to keep our workers safe. As our ecozone workers go home to their communities, may they be our advocates for keeping the household safe from COVID. So again, thank you, and maraming salamat, daghang salamat for your active support and participation, and together we will heal as one. Maraming salamat.
Thank you, Director General Charito Plaza of the Philippine Economic Zone Authority. It is our honor and pleasure to be working with you, definitely, and also with the DTI, Yusek Boy Bismonte, and Dr. Migo Mantaring of the DOH. Yusek Boy, any last words po before we sign off for today's session? Yusek Boy.
Parting, maraming salamat again sa PESA, WHO. Pero sa umagang ito session, mahalaga pong ipaalala natin na napakahalaga ng pag-iingat sa loob ng bahay. Alam ko po iba-iba tayo ng bahay, lalong-lalo na itong mga workers natin sa PESA, pwedeng ang bahay niyo po ay dorm na hindi niyo po kasama ang inyong mga mahal sa buhay. So diyan po kayo gumigising sa umaga. So paalala po, don't let our guards down. Kahit saan po kayo umuwi, bantayan po natin ito pong pag-iingat. Yun lang, Albert.
Thank you, Yusek Boy. Doc Migo from the DOH.
Thank you also to DG Plaza for the invitation, as well as to the WHO, and for the opportunity to represent DOH in this morning session. So as a final message, siguro bida solusyon na lang po tayong lahat, no, laban sa COVID-19. So yung laban nga po na ito ay nasa doorsteps po natin. Before we even go to the workplaces, the main root of everything, of all our interactions, is at home. So practice our minimum health standards and our preventive behaviors, at lahat tayo maging bida solusyon po sa COVID-19 po.
Thank you, Doc Migo. And just a quick reminder, ang ating slides po ipapadala natin at the end of the day. Wag po kayong mag-alala, yung mga ating kasamaan tulad ni Ms. Shine Morcoso. Pwede po kong itanong ninyo yung tungkol sa 14 days at sa swab. Meron pa tayong mga webinars tomorrow, Wednesday. Pag-uusapan na natin pag nakarating na sa workplace, anong gagawin. Lahat ng mga aircon, lahat ng mga bintana, mga pintuan, paghuhugas ng kamay, bukas yan. And then sa Thursday, anong gagawin? What to do if someone is sick? Hala, may umuubo, nakatabi sa loob ng office, ganyan, sa loob ng factory. Sa Thursday po yan. At sa Friday, pauwi na tayo. Kailangan kong mag-grocery. Dadaan muna ako sa grocery, bibili ako o kaya sa palengke. O kaya baka bala kong magpagupit muna. Hindi ko alam kung ano yung routine natin nung pagpauwi na tayo. So lahat ng pag-uusapan po natin sa oras na 11:00 bawat araw. Pwede na pala talaga mag-radio, no? 11:00 araw-araw mula ngayon, Tuesday, hanggang sa Biyernes, dito po sa WHO Philippines. Kung kayo po ay hindi makapasok sa Zoom, huwag kayong mag-alala. Ang YouTube lalabas pa rin po at live pa rin po kayo sa kabila. So maraming salamat po at please have a good lunch and stay safe po. Bye-bye. We heal as one. Good afternoon po.